Unfortunately, my entire family has type 2 diabetes, and my dad, I was 12 and he was 52 at the time, had a heart attack and then passed away due to complications of type 2 diabetes. So that was really my impetus to kind of jump in and try to understand the disease process. I'm Anita Swamy, and I am a diabetes specialist at Lurie Children's Hospital. And in that position, I'm also the medical director of the Chicago Children's Diabetes Center. I am a diabetologist, and when I first heard that word, I thought it sounded really funny. But that's one of the benefits of working at Lurie Children's. There's enough of us, and we have an awesome, cohesive group of people. So if a person's really interested in one part of endocrinology, we can focus on that, and that's what I do. So I work with children who have type 1 and type 2 diabetes. That is my passion. It's my profession. And because of my personal experience with it, I think that the number one key to success when you have diabetes is education. So that's really my platform, is to teach people about it so they can take care of themselves. When I was first in practice, it was just really try to keep that kid out of the hospital. You know, we really didn't know what would be their future. Now I can say, and I can say it with a lot of confidence, your kid's gonna be fine. And I think that speaks volumes when you're a terrified parent or caregiver. The majority of patients that we see have type 1 diabetes, but we also have a fairly large type 2 population because we see that occur more often in ethnic minorities, and we see a lot of diversity in Chicago. So we take care of them both acutely when they present and then chronically and ongoing. So I see my kids at least every 3 months. And that's one of the things I love about my job, because I get to see them growing up. So I work with an amazing group of people who are nurses, nurse educators, nurse practitioners, a group of dietitians, a psychologist, and a social worker. So it really does take a village. And we also work directly with Chicago Public Schools to do all of their diabetes education so that we can reach out in different ways in the community to address the needs of these children, whether they're in school, at home. And my team allows us also to assess what are the barriers. And a lot of it I found goes back to education. They don't understand why we have this or why we need this and what the consequences are. So it's really educating without judgment. I think when it clicks and they start to do well, that's what keeps me going into work every day, is that feeling of like we did it and this person's gonna do well.